we have found the numbers of new cases have almost doubled in a few days. And as of today, we have 172 active cases, 5 still resolved. And we're getting the number of new cases being reported each day is going up quite quickly. We had 32 new ones over the last 24 hours, and a significant number of those that have been investigated were exposed in the United States. Of course, as these reports come in, the local public health unit has to do the case and contact investigation, and as the numbers go up, it takes more time to get through all of those. So at this point, the good part is that we have looked at our sentinel data where we are testing people who are ill in hospital with respiratory infections and a sample of those, and also outbreaks in long-term care facilities. And we've tested, I think, over 1,000, and they're all negative, which is good, very good, that we're not missing those cases. However, at this point, we really cannot definitively rule out community transmission. And so that is why at this point we feel that we need to take more measures, and I'll turn it back to Dr. Williams.
Yes, thank you. And so as we look at that, when we're talking about other tools, so far we're doing containment. There's always a question, and the Chief Public Health Officer kind of said in some parts of the country there is evidence of community spread. We continually try to search for that among our data cases. So far we're holding on our containment, but with the amount of inflow of people returning and the high levels or number of cases of positivity, we have to look at the aspects of how we might contain and control that so we can continue to do our containment type approach in that policy. Now, this is similar to what the WHO had talked about, that if you use social distancing and those measures alone, they work, but not as good as if you can combine containment and augment it by social distancing. So, in that we have continued with the work of public health at the local level. Cases coming in with a travel history or contact of a case were monitored, and they followed up with those, and people around there were monitored, and so you contained that impact in the community. And nevertheless, with the amount of cases and lab tests flowing through, there are some that do not seem to have a travel history or a contact case at this stage. But if you're going to undertake to investigate those ones, it takes a lot more work because you have to go out and identify not who they remember they contacted, but a wide circle of people they might have been in contact with and carry out that investigation. So that takes even further or more public health resources to investigate those, and it does take more time to assess that. At the same time, you can see that our resolves is saved at 5. As the lab system is loading up there, the amount of time you have to do to clear those ones is taking a bit longer, and we have to identify perhaps we don't need 2 negatives if they do 14 and 1 negative adequate. We're trying to address those questions to expedite that process. Besides that, since this morning and some further information that we received and we're working on, that we're taking a number of steps to increase the social distancing, the aspects in consistent with our partners and others at the federal level. We're talking about some additional closures. So we're going to be moving on. The new number is 50. So groups greater than 50, we're not asking those to be meeting. And they would cancel those or decrease them somehow to a smaller size in that aspect. And we'd like that to take place as soon as possible, knowing some will take a while. I'm not talking about weeks, I'm talking about a few days or whatever to get that in place, because there are some stipulations and things you have to do, and we want to work with that. And I've had a lot of emails from different ones asking for some further steps we're going to talk about now. We're asking this affects all recreational programs and libraries. That has been said by a number of communications in. All private schools, not just the publicly funded schools. All daycares in that item. All churches and other faith settings. And all bars and restaurants, with the exception of those restaurants that could continue to do takeout and delivery, because some people would still probably benefit if they're in isolation to have that provision and make that helpful. So we're asking those things to stay there. And there may be other things we may want to consider further, but right now, those are the things that we're really asking to take action on right away, because with the number of individuals coming back in the country, we're going to have to try and put those things in place to decrease the potential spread within our communities.